If we're going to talk about basic first aid, I think we need to start with what to do when a wound first happens.
Yeah.
Okay. And so the first thing you want to do is stop the bleeding.
Okay.
And you do that by applying pressure with any clean gauze that you can find. You want to first apply pressure to stop the bleeding. And if you have bleed or strike through that first piece or pieces of gauze, what you want to do is add more onto it.
Okay, don't pull it off.
Don't pull it off because
you're
you're starting that cascade of blood clotting all the way over when you pull it off. So keep adding until you can get the bleeding to stop. If it's on a arm or a leg, you want to elevate that limb to try to help the bleeding to stop as well. So that's the first part. Stop the bleeding.
Okay.
The second part is you need to clean the wound with cool, soapy water.
Okay.
Not peroxide?
Yeah.
Well, I get that question a lot. People will say, well, okay, I can use soapy water, but can I use an antiseptic? And there's so many that are out there.
Right.
Peroxide, alcohol, iodine, betadine, you name it. I mean, I'm literally from the generation of, I don't know if people will remember, but my grandmother would run get a little bottle of Mercurochrome and put it on everything. It was a little tiny little, and I always say when you know better, you do better. So Mercurochrome was pulled from the market because we found out that the risks were not worth the benefits. We have a lot of better things available. So Mercurochrome, they found it was kind of putting mercury into your system, so it's no longer allowed.
Yes, Mercure.
Yeah.
Right.
Right. So it's not allowed anymore. And what we're finding with antiseptics is we're learning that for first aid, it's perfect to wash something off, get the dirt out, clean it up with peroxide. However, peroxide and some of the other antiseptics should not be used for 2, 3, 4 weeks in a row. If you're putting peroxide on something, you are actually killing the new cells that are trying to form.
No way.
Okay.
Yeah.
That makes a lot of sense.
You go to, let's say you have a child, they go to the park, they get
Absolutely.
a scrape or something. It's okay to, preference is probably to use soapy water to clean it out, but if not, I guess if you want an extra layer, use your hydrogen peroxide or whatever.
Absolutely.
But then don't use it after that.
Correct.
So initial one time,
maybe 2 days in a row, but beyond that, we found that, as the wound continues to heal, because the peroxide and some of these antiseptics are so caustic, it kills bacteria, which is what we want it to do, but it also kills those new cells that are trying to form.
Okay.
And so we talked about stopping the bleeding. We talked about washing off with, cool soapy water. The next step would be to put a thin layer of antibiotic cream and a sterile bandage on it. And then the fourth and last step is to just continue to monitor for signs of infection. And those are going to be redness, swelling, pus, pain. Pain is actually a sign of infection as well.
I didn't know that.
So if your wound is hurting, it's probably leaning more towards being infected. So you have to be careful to watch those things. Stop the bleeding, clean it off with clean soapy water, cool soapy water. You want to put a bandage on it to keep it protected. And then last but not least, keep an eye out for infection.